Should you start hormone replacement therapy? The truth about HRT that no one talks about. Hormone replacement therapy, or HRT, is one of the most controversial and misunderstood tools in women's health. Many says it's life-changing, and some says it's dangerous. And you might be considering, should I start HRT? Will it help me or will it harm me in the long term? So today we're going beyond the surface. In this video, we're talking about what HRT is, what it helps with, and what it doesn't help with, and the long-term potential risk that nobody talks about, and the powerful natural alternative that you can harness to support your health. HRT is a treatment that uses medication containing progesterone and or estrogen to replace what your body no longer produces during perimenopause and menopause. It began in the 1940s but popularized in the 1960s through Premarin, a form of estrogen that made from pregnant horse urine. You heard that right. And in the 1990s, millions of women were on HRT, often indefinitely. It was marketed as anti-aging, protective against heart diseases, and even a way to stay feminine and youthful. And most women use HRT to reduce perimenopause and menopause-related symptoms. Studies have shown that HRT is good to reduce hot flashes and night sweats, sleep disruptions due to hormonal dip, mood instability due to hormone fluctuations, vaginal dryness, pain, and UTIs, loss of bone density, and potentially reduce the risk of Alzheimer's. And although HRT can benefit for many symptoms, it does not fix everything. And here are what things that HRT doesn't help with: weight loss or weight gain, anxiety or depression due to grief, trauma, or life stressors, gut issues or food sensitivity, energy crashes that are caused by adrenal dysfunction, thyroid issues, or poor glucose metabolism. And you might not be a candidate of HRT if you have a history of breast, uterine, or ovarian cancer, have active blood clot risk, stroke history, or uncontrolled high blood pressure, have severe liver disease, and are far away from menopause. There are two types of HRT: synthetic ones and bioidentical ones. Synthetic HRT often includes conjugated equine estrogen from horse urine and metroxyprogesterone acetate, a synthetic progestin. Bioidentical ones contains hormones that are molecular identical to what our body makes, such as estradiol or micronized progesterone. HRT can be very helpful when it's used at the right dosage, right timing, right format, for the right reason. And that depends on three things. Number one, timing. Studies have shown that the earlier you start, preferably in perimenopause or early postmenopause, the better. Starting after age 60 might come with more risk than benefit. Number two, type. Transdermal estrogen that is gel, patch, or cream is better than the oral ones because it bypasses the liver and reducing the risk of potential blood clot. Micronized progesterone is better tolerated and safer than the synthetic ones. Number three, dose. The safest option is to go with the lowest effective dose that tailor to your symptoms, and it's not a one-size-fits-all. In 2002, a study done by the Women's Health Initiative changed everything. In this study, it shows that women on HRT have a higher risk of breast cancer, blood clots, or stroke. However, there are three main points that were often left out. Number one, the average age of the women participated in this study were 63, definitely not in perimenopause. Number two, they were given oral synthetic estrogen and synthetic progestin. Number three, no other factors was controlled, and they did not screen these women for the timing, hormone imbalances, and other health risks. Doctors pulled HRT from millions of women overnight. But later on, study shows that these risks can be mitigated by using bioidentical HRT and starting it from earlier during perimenopause or early postmenopause. Even today, most doctors are undertrained for perimenopause and menopause care, and most women are not aware of their options. However, even bioidentical HRT comes with potential risks. Some short-term side effects include breast tenderness, mild bloating, spotting, or mood changes. And long-term potential effects includes breast cancer. This is still a concern, especially only using estrogen without progesterone. Blood clot or stroke with oral forms, and gallbladder issues also with oral forms of HRT. And unclear long-term neurological effects, especially using after age 65. If you believe, as I do, that our bodies are wise by design, then here are some powerful alternative ways that can support your health. Number one, subconscious rewiring. Emotional patterns that stored in our nervous system can mimic and amplify these symptoms. Tools like hypnotherapy or trauma-informed coaching can calm the limbic system, which directly influence hormone signaling via the HPA axis. Number two, nutrition for balance. A legume-rich, whole food-based Mediterranean diet can reduce inflammation and support estrogen and hormone metabolism. Micronutrients such as magnesium, omega-3s, vitamin B6 and folate, vitamin D, and adaptogens can help. Number three, nervous system care. Exercise, movement, breath work, cold therapy, vagus nerve stimulation, and circadian rhythm can lower cortisol and restore your energy. And if you feel uncomfortable or uneasy using hormone replacement therapy, even if your lab test says so, don't be afraid to trust your intuition, as you can support your body through these times. Perimenopause and menopause are important transitions in women's life, and we are not taught to handle this. And this is not a disease, this is not the end of youth. And this is a time that we are coming back into our body. And whether you choose to use HRT or not, the real work is actually supporting you, your nervous system, your body, your mind, and your soul. And if you're ready to go deeper, I guide women using movement, food, mindset, and subconscious rewiring to help you alleviate the symptoms from this time.